Your child, your spouse, a loved one, a friend is poisoned. Oh no, you call 911, they rush to the hospital, only to find out it's not as serious as you thought. The doctor says they're okay, and they're sent home with a clean bill of health. A couple weeks later, you get a bill in the mail for thousands of dollars, and you think to yourself, if only I could have treated my loved one, done so in a cheaper way. In this video, we're going to discuss over-the-counter medicines you can take for poisonings. We're going to discuss lifestyle changes you can make to prevent poisonings. And then finally, we're going to discuss one way to treat poisonings at home that could potentially save you thousands of dollars, a lot of time, energy, and effort. Stay tuned. Greetings. This is Brandon E., your Pharm.D, and welcome to my YouTube channel. You know, when you think about poisonings, you may think of things like cyanide, arsenic, or carbon monoxide. And while these can all be very dangerous, a poison can be a number of things like medications, whether prescription or over the counter, household products like cleaners, air freshener, and bleach, personal care products like deodorants or aftershave, if they're used in the wrong amount, by the wrong person, or in the wrong way. So let's think about a child. Let's say you had a child and they got into some bleach and ingested some. This would be a poison exposure as the product is being used in the wrong way. Or let's say, for example, you had a husband and a wife, and let's say they're both on prescription medicines. And let's say one day the husband takes the wife's medicines, or another day the wife takes the husband's medicines. This would be used by the wrong person. So what do you do in a situation like this? What type of over-the-counter medicines can you take for poisonings? Let's first talk about ipecac syrup. Ipecac syrup is a medicine that induces vomiting. Basically, it causes you to throw up. It works in about 20 to 30 minutes in both children and adults. Years ago, it was recommended for parents to keep ipecac syrup at home in case their young child ingested something poisonous. They could give it to them so they could throw up or vomit whatever they ingested. This recommendation changed as there was little evidence to show that those that ingested ipecac syrup became less sick than those that didn't. So as a result, ipecac syrup is no longer available over the counter and is not recommended for over-the-counter usage if you or someone you know was poisoned. So now let's talk about activated charcoal. If you watched my previous video on gas, we talked about activated charcoal and how it has to be separated by a couple of hours from other medicines you're taking. This is because activated charcoal can prevent drugs and some poisons from being absorbed into the bloodstream, and it can increase their elimination from the body. So as a result, activated charcoal is used in the emergency room setting to treat certain types of drug overdoses and poisonings. The over-the-counter activated charcoal should not be used for poisonings as it's a much more diluted dosage than the one used in the emergency room. So as a result, activated charcoal should not be used in the over-the-counter setting. It should only be used under the direct supervision of a licensed healthcare provider if you're using it to treat poisons. Other home remedies you may have heard about in regards to poisoning can be raw egg whites, mustard, burnt toast, tannic acid, and milk of magnesia, salt water, and tickling the back of the throat. Okay, so now none of the over-the-counter products that I listed, the ipecac syrup or the activated charcoal, or none of the home remedies should be used if you're treating poisonings over the counter. They're not effective. Don't use them. They don't work. We're going to talk about what you can do in a minute. But before we do that, let's talk about some lifestyle changes that you can do to prevent poisonings in relation to medication. The first thing you can do is to keep all of your medications in a locked cabinet away from children. That one's pretty self-explanatory. The second thing you can do is, if possible, keep all medications in their original container with the label on them. Many times medications have child-proof caps, so if you do have children and they do get in the medicine, they may not be able to open it. Or if you have the proper label on the medicine and someone is looking through your medicine, or you have a spouse or family member that's taking similar medicines to you and you have it properly labeled, you can differentiate between your medicine and their medicine. Next, you want to make sure you never share prescription medicines with others. If a medication was prescribed to you, it was prescribed to you and you only for a reason. Giving it to another person can cause them to potentially have a allergic reaction, an unnecessary side effect. It could put them at risk of drug interactions and harm. So never share prescription medicine. Only use your own prescription medicines and don't use someone else's prescription medicine. Next, you want to properly dispose of your medicines. Improper drug disposal can lead to drug overdose or poisoning in children, pets, and potential drug seekers. So now let's jump into the last part of the video. How do you treat a poisoning at home? We talked about all these things that used to be done but can't do anymore. We can't take activated charcoal. We can't take ipecac. What do we do? And before I discuss that, you're in contact with the person that's been exposed to something poisonous and they collapse, they have a seizure, they have difficulty breathing, or they can't be awakened, you want to call 911 immediately. If they don't fall into one of the categories in which I just mentioned, the way you can treat them at home, potentially saving you money, time, energy, and effort, is to call poison control at 1-800-222-1222. That's 1-800-222-1222. I would memorize that number and share it with your friends and family. When you call poison control, you're connected with a poison expert and they can give you advice on your potential poison exposure. If you should seek additional medical treatment, they can recommend you do that. If it can be treated at home, they can recommend on what you can do to treat it at home. And they're available 24 hours a day, 7 days a week. So we're not done yet. As I mentioned earlier, we talked about activated charcoal in this video. We also talked about it in our gas video. So check that video out next to learn about some other uses for activated charcoal. This is Brandon E., your Pharm.D. Remember to drink water and hope this video helps.